Hi, how you doing? My name's Christina. I'm going to be your student physical therapist of the day. What's your name?
Ashley.
Ashley. My colleagues and I are just going to evaluate you today. Is that okay if we have permission to do some physical work with you?
Yeah.
All right, cool. So, what brings you into the clinic today?
Over the past couple months, I've been having really bad neck pain. It's just been getting worse and worse.
Have you done anything differently in the last couple of months?
No, I mean I've been working longer hours, but other than that, nothing in particular that sticks out.
There are certain positions that exacerbate your pain a little more than normal.
Well, I work long hours, so I sit a lot.
Mm-hmm.
So I've noticed when I sit for longer periods that it starts to really act up.
How would you describe your pain?
It's like a throbbing, achy pain. It just starts to shoot up
So it shoots up.
to the back of my neck.
Okay. So it radiates the top of your head. From 0 to 10, 0 being the best, 10 being the worst, how does it feel at rest when you're doing nothing?
2,
Like a 2? What about right now?
7,
And at your worst? 10, we have to go to the hospital right now.
Well, no, right now it's probably like a 5, 6.
Okay.
I haven't done much, but
Okay,
at the end of the day, it's usually an
gotcha. So would you say it hurts more in the morning or at night?
8 at night.
And what does your neck pain stop you from being able to do? What are you not able to do?
I've limited myself on how much I'm working out. I don't work out as much as I was before.
How many days a week do you think you're working out?
2.
And what else are you unable to do?
Well, just when I'm at work for a long period of time, I just have to make sure I get up and just get out of my legs.
So when you're sitting at work, around how long does it take when you're like, wow, this pain, I really need to get up?
Like an hour or 2.
An hour?
Yeah. Sometimes I don't even realize though until it's already there.
Mm-hmm.
Yeah.
Any past medical history I should know about? Orthopedic history? Family history?
What's neck?
Illnesses in the family? History of cancer?
Yeah, make her high on one side.
Okay.
High blood pressure.
Take any medications?
Birth control.
Birth control? Does the pain hurt your social life at all?
I get really bad migraines sometimes, so.
All right, well, I'm actually going to pass you over to my colleague Mike right now. He's going to run through some things with you. I'll see you again. I see.
Thank you.
At this point, after taking the subjective, 3 possible hypotheses are upper cervical instability, upper cross syndrome, and an elevated first rib.
Okay, Ashley, so Christina let me know a little bit about what's going on. So now if you don't mind, we're just gonna do a little screens and just see what we're dealing with, get a better idea, okay? So I want you to sit how you normally would sit. All right, so I'm seeing a little forward head posture, definitely rounded shoulders, slightly kyphotic. What that means is you're just a little rounded here, not too bad though. All right, let me see you from the front. Your left shoulder is a little higher than your right, which you're probably right-handed. Okay, so there's always a little difference there. All right, now do you want to have a permission to touch you? Okay. So I'll check for any warmth or see if your muscles are tight. So here, let me know if you have any pain through here. Definitely a little hypertonic and tight through your levator traps. Just gonna kind of poke around you, let me know if anything's tender. Just feel a little tender, huh?
Yeah.
Okay. Look at her spine. Any pain through there?
It's a little tender.
A little tender up through the spine. This process is okay. How about on the sides of your neck? A little hypertonicity on both sides, just meaning that you're a little tight. Forward rounded. Okay. Good. And then get any pain through here? Okay, nothing in here. Back minor. Good. Same thing over here. Okay, good. Okay, and nothing up in here? No. Okay. How about up in here?
Yeah.
Yeah, those are very hypertonic up through here, very tight and irritated. Okay, so now what I'd like to do is just kind of run through some range of motion screens for you. So before we get going, all I want you to see is just kind of sit how you normally would be sitting at your desk. Good. Let's see you tip your head back. Okay, good. Not going to give you any overpressure. Can you come back to neutral? Okay, good. Now what I want you to do is kind of, this is like a little chin nod. Now I want you to chin nod and bring your chin down towards your chest. good. And just a little overpressure. Does that bother you at all?
No, because I stretch.
Feels like a stretch. Okay. And then come out of it a little bit, and then gently kind of push back into my hand. Okay. That hurts you a little bit.
Yeah.
Okay, good. Now let's bring your head back up to neutral. Okay, what I want you to do is kind of look about 2 ceiling tiles forward and kind of stick your neck out in front of you, okay? Right there. And what I'm going to do is put my hands here. And I want you to push down into my hand. Okay, definitely a little weak there. Okay, come back to neutral if you wouldn't mind. Good. Now I'm going to kind of put you here. So I want you to nod right there and then bring your neck right there. Is perfect. And then I want you to push forward. Okay, also a little weak there. All right, next one, I want you to bring your left ear to your left shoulder. Okay, it's not too bad. A little overpressure. Good, and then come off a little bit and push back into my hand. Push into my hand. Okay, a little weak there. Good, and then let's go to the other side. Good. Good. A little overpressure, come off, and now push into my hand. Good. Weak there on both sides. Good. All right. Now what I want you to do is let's look to the left. Just bring your left chin over. Good. A little overpressure. Good. And now push back into my hand. Not too bad. Let's look the other way. Good. Right there. A little overpressure. And then come back into my hand. Good, good, good. Okay, now what I want you to do is just keep your head in a neutral position, okay? And don't let me move you, okay? So I'm going to try and tip you this way. You okay with that? Okay, I'm going to try and tip you this way. Okay, a little bit on both those. Let's push down. Good, gets a little chin poke there. So we definitely need to look into that. Keep your head here, don't let me push forward. Very gently. Okay, and then side to side. Good, that's difficult. And that's difficult. Okay, good. All right. I'd like to look at a little bit lower on your spine. Okay, so what I'd like to do is just stay where you are. Okay, don't let me push. It's a good core, but I notice when you do that, you're leaning forward a little bit. Okay, don't let me push you this way. Not too bad. Good job. Okay, don't let me tip you this way. Okay, and we've got a little heads leaning to the right when we do that. Okay, other way. Same thing. Good. Okay, let's try that one more time. Okay, a little weak there. All right, and now don't let me rotate you, okay? Good, not too bad. Okay, good. Okay, so during the posture stream, I did notice you were a little forward rounded, so I'd like to check your upper thoracic spine, which is basically here to here, and see if that's moving appropriately for you. Is that okay? All right, so the first one I'd like to see is just kind of cross your hands. Okay, keep your chin kind of knotted. And all I want to see you do is kind of come down in forward flexion. Good. I'm going to give you a little overpressure. Does that bother you at all? Good, and you have plenty of motion there, and that looks pretty good. Now what I'd like you to do is grab the back of your neck, okay? And I want you to keep that chin kind of knotted, and let me kind of take you here, okay? So I'm going to be checking your spinous process, in between the spinous process to see how they move. Good, and then we're going to come back. You let me know if you're uncomfortable, and that's very, very tight. You don't like that. So what I was feeling is your spinous, in between your spinous processes, they kind of get stuck and they don't actually close, which is the way that they should close when you go into extension. They should close like that. Yours kind of stay.
All right, so in order to assess the ligament upper cervical spine instability, we're going to perform the Sharp Bursa test. We are going to check how well that C1 is stabilized on C2. So what we're going to do now is you're in here for headaches, right? So what I want to do something. I want you to tell me if the symptoms get reduced or get worse. So first, I want you to kind of just get a nice posture, upright posture. I'm going to stabilize with my left hand onto C2. I'm going to have the patient flex their head. As I stabilize C2, I'm going to have the patient come up into neutral, and I'm going to apply posterior force with my right hand. As I stabilize C2, I'm assessing for any kind of translation, any instability, as well as the reproduction of symptoms or the reduction of symptoms. So as I do this, I'm going to ask the patient very symptoms worse, better,
Same.
pretty much the same.
Yeah.
So this will indicate a negative sharp Mercer test. So another test we could do to test for any upper cervical spine instability is going to be the alar ligament stress test. In this test, we are going to test the bilateral alar ligaments in rotation or side bend. So again, I'm going to stabilize at C2. So once I find C2, I'm going to make a pinch grip. Get a slight flexion. And again, we're assessing for any excessive movement. At this area, there should be very minimal movement when you stabilize the C2 spinal process. So I'm going to put in a tight flexion and produce a counter force. There was a little bit of laxity there in that direction, so I'm going to compare it to the other side. Again, stabilize C2. Mention that. All right, so there is a little bit more movement than we want to see. So that's actually a positive for the alar ligament stress test. So another thing we want to rule out is possibly an elevated first rib that's contributing to her symptoms. So what we're going to do first is we're going to assess the right first rib or any possibility of the right first rib elevation. So what I'm going to do is now I'm going to rotate her head to the left. Here. And I'm going to pass it slowly and passively flex her neck. And I'm assessing for any end field discrepancies or range of motion. So right now it feels like a normal end field. Well, what we do to confirm our findings, we're going to assess the other side. So we're going to rotate to the right and passively put her into the lateral flexion. And very similar end fields on both of those, and no prominent rib popping up into my thumb. So that's a negative.
The functional test that we are choosing today is going to be a left to right rotation from left to right, because our patient at work has to keep her head on a swivel to look between two different monitors. Her give was a chin poke. So we're going to do some things today that are going to try and take away that chin poke for a better quality of movement, decrease in pain. So the first thing that we're going to do is apply external stabilization at the neck. So what I'm going to have you do is, just like when you're at work, your head is all the way to the left and you're going to move it to the right. So I'm going to compress and lift. Go ahead, from left to right. And how did that feel?
A little bit better, but just felt more like stable.
Stable, okay. And your quality of movement also looked good too. You didn't chin poke as much. So what we're going to do is apply a motor cue. So what I want you to think about is, again, you can look to the left, is if there is a string on the top of your head to the ceiling, and that string is pulling your head up. And now make the movement. Okay, and how did that feel for you?
A little better.
Yeah, and the quality of movement looked good too. Okay, so I'm just going to keep going down the chain. So right now we have motor cue worked at the neck, the cervical spine. So now we're just going to go over to the T-spine. We're going to compress and lift. Go ahead. Okay, how did that feel for you?
A little better.
Yeah, quality of movement looked good too, and I didn't see any chin poke. So we're going to move on and do the cue. So I'm going to have you slightly bend forward. Are you a righty or a lefty?
Right.
Put your right hand right underneath your left hand over on your stomach. And what you're going to do is yourself, with your right hand, bring yourself upright. We're going to do that again, but I want you to keep that your head to the left. So bring yourself up with your right hand, and now make the movement. How did that feel? The same? Okay, well, your quality of movement, you still have that chin poke. Okay, so what we're gonna do is keep going down the chain. We're gonna go to the scap. Here, you don't need to. You go to the left. Okay, go ahead. Alright, that didn't work. Okay, we're gonna do the same thing on this side. Go ahead. No. Quality move. I'm gonna have you come over here towards me. I'm gonna compress and lift, relax. Press and lift. Go ahead. Your head to the left. Relax. Go ahead. Still seeing that chin poke. Right, we're gonna do the same thing on this side. Good. Relax. Go ahead. Still seeing that chin poke. Okay. As of right now, motor Q worked at the cervical spine and external stabilization at the T-spine helped.
So as of right now, we are leaning towards a pathoanatomical diagnosis of an upper cross syndrome, and this is due to uncontrolled movement of the upper cervical spine, possibly due to hypomobility of the thoracic spine, driven by poor motor control for the deep neck flexors. We ruled out other possible pathomechanical diagnoses because the only things that really worked was the external stabilization at the T-spine and the motor control cue at the cervical spine. Right now, our primary driver would be the motor control cue because at the deep cervical flexors, because that's what worked the best. But also in the future, we want to try and possibly dive in deeper into the hypomobility of the thoracic spine.
All right, so I'm just going to be addressing your spinal mobility. All right, I'm going to be doing something called a pivum and a pavum. What I want you to do is put your hands behind your neck and keep your elbows in. I'm just going to hold on to you. I'm going to be placing my fingers here on the spine's processes. Now what I want to feel is them closing as I bring you back, which I'm noticing a bit of limitation. So now what I'm going to do is as I push you back, I'm going to give it a little overpressure, okay? Just let me know if you're uncomfortable. So I'm going to go through and we're going to see, do we get a little more? And it seems like we get quite a bit more through that. All right, so that's just something else we're going to use with our assessment later and how to help you out, okay?
So based off of our findings during our functional assessment, what we're going to do is we're going to kind of dive into that motor control aspect of her give. So what we're going to do is kind of cue her to perform that chin nod, and we're going to assess their deep muscles' ability to activate and maintain position throughout range. So first I'm going to do the two pencils coming through your ears, and then you're going to kind of tuck that chin nod in. All right, and kind of go as far as you can get. So right here, I'm assessing her ability to get throughout range, the quality and fluidity of the movement, and her ability to maintain that movement. Come back up, and then in just a subtle movement, maintain that position. And all right, so throughout range seemed pretty good. Now we're gonna assess her ability to disassociate while maintaining that cue. So I'm gonna have you come to the wall. So now we're gonna perform our motor control assessment. So I want to see the patient's ability to maintain that chin tuck position while moving her distal limb. So what we're going to do, since our give was in the transverse plane, we're going to keep the distal movement within the same plane. So with that right arm, we're going to rotate to the right and kind of come back and forth while maintaining that chin tuck position. Good. Now I'm assessing her ability to maintain that position while moving her right arm. Ideally, we don't want it to be fatiguing at the C-spine. It's the motor control breakup, so we're just looking at fluidity and control throughout the range.
So now what we're going to do is going to work on those stability muscles within your neck, okay? So what I'm going to have you do is that same metaphor before with the pencils in your ears. You're going to rotate your head forward and maintain that position. I'm going to have you hold that for 2 seconds, 10 times to really build up that stability strength within your neck, okay? And then we're going to keep doing that, and then we're going to progress it more until we have good, strong control. And then we're gonna get you going with other stuff, okay? Based off of our pivot testing, we found that there's, lack of extension throughout the thoracic spine. So now what we're gonna do is we're gonna perform a little bit of mobilization. I'm gonna be placing my thumb along the spine's processes, placing my other hand over the top. And now what I'm going to do is gonna be bringing down to a mob of 3 or 4, and gonna be oscillating gently back and forth to help develop that mobility within the spine, to help her regain that extension again. To address the tightness within the back of your neck, we're going to be doing a little bit of a suboccipital release. right? Which is going to just stretch those muscles out for you. So what I'm going to do, I'm going to be placing my fingers on the occiput, and what I want to do here is pull back and give you a nice little stretch distraction, and then I'm just hanging out. And we're going to just do this till your tolerance or when it starts to feel better. And of course, let me know if there's any pain or any discomfort. That's it.
Okay, so after all of the interventions that we did, what I want you to do now is we're going to retest the functional rotation of the neck. So you're going to tuck that chin in again, and you're going to look to the left. Good, and then rotate to the right. Good. How does that feel?
Feels a lot better than before.
Okay, good. So now we're going to provide you with an HEP. So we're going to give you just 3 exercises to do at home. So one is to, actually, since we have a chair here, you're going to sit in the chair to address the hypermobility in the thoracic spine. We're going to have your hands behind your neck like this, and all you can do is lean back into the chair like that, okay? Hold it for 2 seconds, come forward again. Hold it for 2 seconds, come forward again. Okay, so give that a try. So it's like arms in there, good. Just lean back. Is that okay? Good. We're going to have you do 3 sets of 10 of those, okay? All the exercises that I'm going to give you is going to be on a handout, and I'll give that to you at the end, okay? The other one we want you to do is the chin nods. So you remember the pencil through the ears, and you're going to set the chin in, yep, just like that, okay? And they come back to neutral, good. Again, 3 sets of 10 of those, okay? And the third one we're going to do is pec stretches. Let me have you stand on up. This is just to address some of the tightness up in the pec muscles here. So you're going to go to a doorway. Open this door, it's a little noisy in here, sorry. And you're gonna lean, put your arms up against the wall here, and then you're gonna lean forward, okay? So go ahead and just put your arms up the wall. Elbows up against the wall here. Remember, elbows apply the chin nod. Lean forward, good. And then you should feel stretch going across the front of the chest. You feel it there? And so we're going to do that 4 times. Okay? Do you have any questions? Okay, good. So your next follow-up, we're going to have some more. So for your next appointment, we're going to follow up with how you're feeling and see if there's any improvement or if it gets better, it's the same or worse, okay?
Okay. Thank you.
Nice meeting you.